I'm going to get started with our introductions here just so we have as much time as possible with our great presenters. Hello and thanks for joining us for today's webinar from the Institute for Research on Poverty at UW-Madison. I'm Judith Sears-Poisson and I'm happy to be your host. Our webinar today is on surveillance of mothers living in poverty, effects on children, families, and communities. And we're fortunate to have two wonderful researchers with us today. First, we'll hear from Dr. Darcey Merritt, who's a professor at the Crown Family School of Social Work, Policy and Practice at the University of Chicago, and she is also an IRP affiliate. She'll share her research on and insights into the history of family separation in the United States and how individual and systemic racism and other forms of oppression affect mothers of color living in poverty. And then we'll turn to Dr. Kelley Fong, who's an assistant professor of sociology at the University of California, Irvine. She'll share the experiences of poor mothers who have come to the attention of child welfare agencies, as well as her interviews with CPS workers and mandated reporters that come in contact with these families. She'll be drawing from her excellent recently released book, Investigating Families: Motherhood in the Shadow of Child Protective Services, that was published by Princeton University Press, and we'll drop a link to the book in the webinar chat so you can all find it. This webinar is supported in part by funding from the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation, but views expressed by our speakers don't necessarily represent the opinions or policies of that office or of any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from each of our presenters, we'll spend the last 15 minutes or so at the end for live Q&A. You can type those in through the Q&A box. We did get quite a few questions submitted as all of you registered, so we will be queuing some of those up as well. I hope you'll also feel free to participate in the chat. We love to hear from you, and especially when folks have resources to share. We appreciate that. I want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. And we'll be posting the slides and the recording of the webinar within a day or so. And you'll receive a link to those by email as long as you've registered. So with that, thank you again for being here, and we'll get started with Professor Merritt.
Thank you. I'm going to attempt to share my screen and hopefully do it correctly. Oh my goodness. Thank you for whoever's technologically savvy.
Thank you, everyone.
All right, I'll start over. I'm happy to be here, and at least we started with a little bit of comedy with my technological challenges. I'll also note that I'm suffering a cold, so if I sound a little coughy, please forgive me. So I'm going to start by just sharing a snapshot of the history of family separation in our country, followed by discussion about racialized poverty-related unintended neglect. And then I'll go into discussing the notion that racism is actually a mechanism of disproportionality, highlighting the design flaws of CPS, the impact of mandated reporting laws, and the consequential harms. So I'll share some qualitative accounts of lived experiences of some moms that I've interviewed for my studies. I want to point out that at the outset that 3/4 of the kiddos that are impacted by CPS are considered neglected, mostly poverty-related neglect. And I need to be clear that I don't study instances of physical or sexual abuse or any intentional maltreatment. I study the cases where the conditions that lead to neglectful behavior are completely outside of the control of parents. So here we have, I just want you to take a look at this and let it digest. We have a history reminder directly related to family separation that's baked into our policies and our practices. Note the caption on the bottom acknowledging the separation of mothers from their husbands and children was actually a very normative practice. Here, I'm listing these policies and examples of generational oppression just to illustrate a snapshot of how harmful policies, many of which are intentional, and indicators of lived socio-political experiences. Each of these 12 bullet points warrant at least a dedicated discussion, which we don't have time for today. So I'm just highlighting the short list of these salient bits, but this is by no means exhaustive. The United States, as we know, has a very storied history of discrimination and continues to manifest in structurally oppressive systems, including in many of our social and human service agencies. It's important to note that structurally racist and oppressive societal and environmental contexts are actually the backdrop with which all systems are underpinned. Institutional racism can oftentimes be subtle and until recently, for the most part, unheeded by child welfare scholars and family-serving professionals, particularly regarding Black families. So my work suggests that inherent race-based inequities are systemically supported and perpetuated in all aspects of CPS processes. The lived experiences of CPS impacted families and their perceptions of racism amidst these systems exposure are directly related to marginalized people with lower socioeconomic status and all the challenges to thrive in our society. So despite the ongoing debate around the causes of racial and ethnic disproportionality and at what point in CPS processes this occurs, the child welfare system cannot be immune to the undercurrents of racism, and we need to be mindful of the impact on minoritized families. I'll highlight also that I use the term CPS impacted because based on many conversations I've had with Black moms, they prefer not to be referred to as CPS involved because they don't consider themselves to be voluntarily involved. So I'm changing my language based on what I'm learning from them, and I want to be respectful as possible in those regards. So while viewing the photo on the right, consider these words of a mom that I interviewed. Basically, I thought when child welfare comes, you lose your kids. Once they get involved, I just gave up because to me, you know you're going to lose your kids. And that's why I came back to help other parents and be educated and empowered in this process. You're not seeing those words there, but she's an advocate now. Child welfare is the same thing as slavery, separating families, just like slavery days. Same thing, same outcomes. So as a recap of American history, as my people were trafficked here, literally, between 1619 and 1865 during slavery, white people forcibly and often violently enslaved people of African descent, and they were identified as chattel. My enslaved ancestors were robbed of their human rights and parental authority to protect their children, making decisions regarding their children's well-being, and as a result, enslaved children and their families lived in constant fear of being separated, not unlike now. Here's an example of the trust that used to be placed in the hands of Black moms to raise white children. Now we lovingly refer to these women as the help in some privileged communities. And I'm just really baffled with the notion that it was and is still acceptable for Black moms to parent white children, but they are often not trusted to parent their own babies now. Perhaps the driving factor in this is the trust that's embedded in the surveillance and oversight that comes with proximity to white families and that accompany surveillance. The other picture makes me wonder what CPS decisions would have been made back then. Would mom be considered neglectful for child labor or placing a child in danger based on the elements of that cotton field? Or would she be considered protective and resourceful and resilient, having made a good decision to not leave her child behind when she went to work? And this mom describes how she's just plagued by not being able to explain to her kids what's happening. You can't even tell your kids why they can't go with you. They're screaming, "No, mommy, I want to go with you. No, mommy, no, mommy, I want to go with you." If you have three coming at you, one's on the ankle, one's on the arm, one is going, then there comes these people to rip your kids off you, screaming as we did on the slave trade block. Same experience at the visit. It's important to know that neglect cannot be disentangled from race and poverty. CPS is indeed appropriate to protect children from physical or sexual abuse. However, again, I'll remind you, these are not the kiddos that I study, but a vastly different approach is needed to protect kids from racialized poverty and those consequences. So when we talk about requiring minimally adequate care to mitigate maltreatment, neglect specifically, we must immediately consider financial well-being and how families are resourced to provide that minimally adequate care. The policy flaw is that CPS was not designed to address the root causes of poverty. It is supposed to be an intervention to address harm from intentional physical and sexual abuse, which has been totally conflated with unintentional neglect. And so we need to consider under what context adequate care is evaluated and why we have seemingly divorced ourselves from the overarching societal ills and the etiology of these conditions that cause neglect to happen. So the intersection of populations of too fast. The intersection of populations of color and those with low socioeconomic status results in the system's over-surveillance and the biased judgments regarding child maltreatment risk. This intersection is best understood as racialized poverty in the United States, is specifically associated with Black African American families that are involuntarily living in poverty and suffering systemic oppression, but just based on the skin they live in. It's critical for all of us to acknowledge that experiences with poverty are intensified by the structural racism as it is in practice, such as mandated reporting laws, which I'll talk a little bit about soon. Frankly, we haven't examined well the CPS surveillance of Black families, considering the historical oppression and the racialized poverty that they've endured over generations. This racialized poverty shapes negative perceptions of these disenfranchised people and seeking and in need of equitable support. And these perceptions are embedded in the institutional procedures and the policies of the systems that are actually responsible for protecting children, and they inform the processes of the surveillance that's so harmful. So for sure, poverty, particularly extreme poverty, is a form of trauma, and it results in a host of poor outcomes, poor functioning, suboptimal behavior choices, and the social and moral determinants of this oversight are generally outside of the control of parents, primarily due to their positionality in our society. And we are also much more prone, unfortunately, to assess risk factors than assess family strengths and resilience in context. And this results in a much higher likelihood of initial CPS oversight and ongoing surveillance. We're always looking for risk first, and we don't do a good enough job looking for the strengths and what works. So I'm positing that racism is actually the mechanism by which CPS racial disproportionality occurs. We have, and we will continue for years to come, try to unpack this, but we really need to add the historical and structural context of systemic racism as a primary variable. However, we don't have any good measures of that. So I want us to consider racism as the driver of concentrated poverty, which then leads to racial disproportionality. I put forth these two pathways for consideration with an emphasis on the first societal ill, which is the racism. I also inserted neglect to remind us of the 75% of the kids deemed maltreated are due to poverty-related neglect and having economic hardships. So, as you likely all know, CAPTA is a landmark legislation that established the modern child welfare system. But while CAPTA created federal definitions of child abuse and neglect and established the grounds to fund research, it also started the criminalization of families' needs rather than the creation of family supports. CAPTA focused on child abuse and neglect without challenging the larger context of discriminatory legacies, policies, practices such as white supremacy, nor has it sought to build support for children and families regardless of race. So the CAPTA family preservation era laid out a host of requirements for federal funding, such as Title IV-B and E, centering on prevention efforts, permanency and adoption, support for at-risk family, and of course, out-of-home placements. Following family preservation era led to the ASFA, the Adoption and Safe Family Act in 1980, and that was a response to unsustainable and unacceptable increases in children being removed from their birth homes and placed in alternative placements such as foster and kinship care. So the three primary goals of the legislation, safety, permanency, and well-being, safety being the most elusive, I think, in addition to well-being, to try to figure out, because are we keeping children safe from poverty? Are we keeping children safe from violence, unhealthy food, unsafe housing? It's different than physical abuse and sexual abuse safety when we're thinking about neglect. Permanency as a primary goal to avoid kids from being unduly shifted from one home to another placement, but each and every time they go to a new home, from the first time and onward, it is absolute trauma. The concept of well-being is also elusive because well-being can mean different things according to who you ask, and we often don't do a good job asking parents what they think well-being means for their own families and in their communities. So we need to consider if child protective services are protecting kids from harm and the bulk of the children are primarily served due to their low socioeconomic status, then are we saving them from the harm of poverty? And if so, do we need to continue stigmatizing and essentially blaming families for being poor? We have to remember that living in poverty is unintentional, unless somebody out there is a Buddhist monk, And so it follows that poverty-related neglect is unintentional. If I could see all of you, I would ask you to raise your hands if you would like to be poor and experience racism. I don't think many people would raise their hands. So some advocates, specifically Dorothy Roberts, has renamed CPS the Family Policing System, and I agree with that wholeheartedly, but I prefer to think of it as the Child Poverty Surveillance System because that's essentially what's happening. Experiencing poverty and racism is unintentional again, and the consequences of these experiences shouldn't be blamed on parents that are just trying to raise their kids to the best of their abilities and available resources. So I believe parental behavioral intentions should be considered as a function of their available resources and histories with this discrimination, and of course, in consideration of their environmental context. CPS oversight is stigmatizing, particularly related to poverty amongst minoritized populations. These parental behaviors and are related they should not result in punitive CPS oversight. So if we're going to rethink CAPTA, scholars point out the design flaw in that it was not intended to mitigate the impact of poverty. Their processes are by design coercive and oppressive to marginalized families. From initial contact and over the course of CPS exposure, intentionally non-judgmental, rather respectful approaches are critical when working with these families. We should not deem these poverty-related behaviors intentional maltreatment. And it's important that we implement racial bias awareness at each decision point. It's imperative, and we should hold people accountable to constantly assessing how their biases are impacting these decisions about the lives of children and parents, including the initial oversight and all subsequent placement decisions. So given initial CPS exposure begins with referrals from mandated reporters in schools, communities, medical fields, any other settings where youth interact with adults outside of their homes. Marginalized parents make their decisions based on avoiding or mitigating these intrusive systems and the oversight. Black parents, the ones that I've interviewed, curb their behavior pretty drastically and adjust their choices so as not to interact with those people who are most likely to be compelled to make a CPS report, either out of an abundance of caution or the threat of the consequences or inattention to their own personal biases. Mandated reporting policies are central to the harms families experience through the threat of removal of their children. Among my sample, moms expressed interacting with the world through fear, always needing to be hyper vigilant about systems in medical settings and at schools, as well as at community level settings such as public housing. Additionally, they felt compelled to interact cautiously with others in their own communities because unfortunately it's not uncommon for anonymous, malicious, false reports to be made, thus weaponizing CPS. So parents overwhelmingly display hypervigilance in documenting and defending their behaviors. Imagine having to document every single thing you do with your child, taking them to the doctor, taking them to a sports group, anything, and then one has to document in order to prove that they're doing something right. This is an account of one of my moms regarding the impact of surveillance. She says, you can't avoid it because we're over surveillance, right? We are in too many mandated reporters' eyes. What we need to do is change the way parents, family are responded to in crisis. We've got to change the response, right? From punitive responses to responses that actually help towards healing and keeping families together, mitigating their crisis. The response normally is penalizing families for even having their crisis. And a lot of the moms that I spoke to know really well what it means to have caseworkers coming into their house and treating them as if they're under a microscope. And again, they navigate the world in a very disturbing and different way. You think about, again, having to document every single thing. This mom is saying that she feels like there's always someone watching you. If she makes one wrong move, I'm stuck in the situation. She thinks money has a lot to do with it. One of the first things that she said, that she's speaking about the caseworker, said to me was, I see that you used to receive food stamps. So I'm already on your radar. I know how it works. You're looking to people that are already poor and qualify for government assistance. And that's just an example of how this multiple systems oversight plays a role as well in contributing to the surveillance and the oversight. When you're under the eyes of one system, then you are ultimately going to be under the eyes of all others with all kinds of judgment. that's just a snippet of my work, and I wanted to always at the end of my presentations offer my respect and appreciation to the moms that entrusted me with their stories. I'm humbled that they trusted me with their stories. And that's all I have. I'm going to turn it over to my colleague Kelley, who hopefully can get her PowerPoint set up without glitches like I did.
Great. Thanks so much, Darcey, for that really insightful presentation. I think you just so clearly outlined the key issues at play here in this space. Thank you so much also to IRP for hosting this webinar today, and to Judith for moderating, and to all of you for joining today. I see we have over 500 people here live, which I think really speaks to the interest in this important topic. So I'm excited to share a little bit of my research with you today on the surveillance of mothers living in poverty. So imagine that a stranger comes to your home one day to knock on your door. Maybe some of you have had this experience, or maybe some of you have been this stranger. They're from the state. They'll have a lot of questions for you. They'll ask to look around your home. They'll ask to speak to professionals in your family's life, like doctors and schools and mental health providers. They'll run background checks on everyone in your household. All of this is considered best practice in the field. So you might feel that you have to answer their questions and agree to their requests because they have a lot of power. So they'll come to know a lot of intimate information about you and your family. So as one of these workers said by way of explanation or introduction to the family that he was inquiring about, we literally ask everything. So this scene is repeated every day all over the country. When we look at who is impacted, we see that it's not only the sort of staggering statistic that 1 in 3 US children will experience one of these CPS investigations at some point by age 18, but this is actually 1 in 2 Black children. So half of Black children will come into contact with CPS via an investigation at some point during childhood. Investigations are concentrated disproportionately on Black families, Hispanic families, Native American families are also especially likely to come into contact with the system. And these families are almost all low income, and it's women and mothers in particular who are experiencing CPS's investigations most intensively. So in this sense, we're seeing this extensive state surveillance of poor children, poor families, poor mothers of color. Now, I want to start by saying that I understand that surveillance can be kind of a loaded term with these negative connotations. And if we can just maybe bracket that for a little bit, I think that at its core, surveillance simply refers to information gathering. And this information can be gathered for various purposes. It can be used to identify candidates for assistance, for punishment, for anything in between. And so in this sense, I think that it's uncontroversial that CPS is engaged in surveillance, and in very intensive surveillance at that. And so there's been a lot of attention to, for instance, stop and frisk and other proactive policing practices that primarily impact young Black and brown men in impoverished neighborhoods. This attention is, of course, warranted. And what Darcey and I are highlighting here today is the way that there is this parallel surveillance process happening for the women in these same communities. And this process is actually much more informationally invasive. So what I'll discuss today draws on research that I've done in Connecticut and Rhode Island on CPS, published in my book, Investigating Families. So I saw a few Connecticut people in the chat, which was exciting to see. In Connecticut, I shadowed CPS investigators and interviewed some of the key players on those investigations, from investigators to investigated mothers to the professionals who called in the cases. And in Rhode Island, I interviewed low-income mothers who had various levels of contact with CPS, including none at all. And so in this research, I saw how the bulk of CPS reports involve these kinds of situations. And Darcey also helpfully went over this as well. These kinds of situations that largely reflect family adversity, they're sort of manifestations of poverty and hardship and systemic racism. So those extreme cases of abuse that you might see in the headlines really are extremely rare. This is primarily what CPS is dealing with. Now, I don't want to discount that these can certainly be challenging experiences for children, but the focus here is on what our state and social service response to these challenges looks like. So it turns out that of those millions of investigations conducted each year, most of them end up closing without CPS identifying sufficient evidence to conclude that abuse or neglect occurred. But nevertheless, families experience them as terrifying, right? This is the stranger with the immense power to separate your family, coming into your house and inspecting what you're doing. You can't necessarily know what it is that they're looking at or what they might, try to get you on. So all of the names I'm going to use today are pseudonyms. Paulina was a mother in Rhode Island who had recently been investigated by CPS when I spoke with her, and she described what this experience was like. She said, "My heart fell in my stomach because I was like, I knew that there was nothing wrong with my house, but it's just, I don't know. It's like being with the cops. I don't have no record, but when there's a cop behind me, I'm like, oh God, that's a cop behind me. Oh my God, he's behind me." I was nervous as hell and I knew my room was clean, but it's just the fact that you have to defend your motherhood. It was just an emotional roller coaster because now I'm scared to have my room dirty at any point. So even parents like Paulina, who felt confident that they weren't, doing anything wrong, nevertheless felt apprehensive because it's CPS who gets to determine, what information they're going to act on, how they're going to interpret what they're seeing. Everything is on their terms. So investigations also threaten families' sense of privacy, which we might think could be warranted in some cases if there are serious safety concerns. But again, this is not typically the case. So Nikki in Connecticut talked about her recent investigation saying, they go in people's past. My son is 16. Do you know what my son say? He said, "Ma, you got to know that I'm on probation in all of this. You don't need to know all of that. They just do too much." So the inquiries that CPS is making go well beyond the initially reported allegations. So I came to think of these reports as like issuing CPS like a blank check to go in and ask about anything at all under the sun. And this is actually by design. So CPS is looking to do this kind of holistic and wide-ranging assessment rather than just narrowly focusing on the specific issues that have been reported. But how mothers experience this, as Nikki said, is this experience of just wanting to keep the agency far from them at all costs. So she said, I asked, what makes you not want to go through this again, which she had indicated earlier in the interview, even though her case was closed. So she said, it's just having them in your life, having somebody else in your life that's not supposed to be here, asking all these questions, wanting to know all this stuff that they don't need to be knowing. I would never want to go through that again, and I would never advise nobody to go through that. So mothers also articulated concerns about what would be done with the information that CPS was gathering and whether they could trust what the agency was telling them. So Gabby was an undocumented mother who explained, I think a day or two after the investigator first visited. She said, they told me, even though I don't know if it's entirely true, that they have nothing to do with immigration. They are not here to write a report on who I am, but they are focused directly on children. I want to believe it's true, and at the same time, I doubt it. Everything that has to do with law makes me doubt because of my status here. So on the one hand, CPS was telling her that they weren't going to turn her over to immigration enforcement. On the other, in the visit, the investigator kept pressing her about whether she had previously gone by any other names, even when it was clear that this was making her a little bit anxious and she was sort of trying to defer or like evade the question. The investigator nevertheless kept pushing. Other mothers I spoke with weren't sure whether the agency had truly closed out when they said that they did. So they worried that CPS could still just pop up on them at any time to check in on things, which is a reasonable concern for families who have had repeated encounters with institutions that have shown themselves to not be trustworthy. So as expansive as it isn't just CPS that's surveilling poor families. It's this whole network of agencies and organizations surrounding them that are in a position to evaluate their parenting. So pretty much all of the professionals that families are coming into contact with are what's called mandated reporters, as Darcey was referencing. And these reporters have been socialized to see something and say something, even if you just have this kind of inkling in your gut that there might be something going on, you're encouraged to make that call. So to some extent, this feeling of being watched and judged is sort of extends to parents and mothers, maybe beyond social class and race and ethnicity. But of course, the stakes are very different because for poor mothers and mothers of color, the consequences of this judgment, of this watching are, they're much more likely to, the judgment is much more likely to bring in a state investigator with the power to take their children. So all of this surveillance is concentrated primarily on poor families and especially families of color. And Darcey outlined some of the key reasons why this is the case, especially pointing to some of the historical origins of the policies that we have in place. Certainly, there is sort of a piece of this that's about the way that hardship and adversity have become framed as maltreatment. And in addition, poverty and systemic racism shape the way that, or the extent of interactions that families have with systems that ask lots of questions or that are privy to families' private lives. So in California, where I live, pediatricians, for instance, are reimbursed for screening their Medicaid patients for adverse childhood experiences. So they're gathering a lot of information about the adverse experiences of poor patients, not so much non-Medicaid patients. Similarly, Kiara Bridges, who's an anthropologist and legal scholar, has written about how Medicaid patients and not those on private insurance are asked a whole battery of personal questions at prenatal appointments. Poor families and families of color are also highly exposed to police, to homeless shelters, to home visitors, all of these professionals who are in a position to be watching them and to be seeing something and saying something. And so Roxanne outlined how she understood this role of home visitors. She said, sometimes it looks like they're trying to see how you live, to see if your kid is well with you. You know what I'm saying? To make it a CPS situation if it's not okay. Like I say, they would go visit a house that had roaches crawling over the wall and mice running through their feet or something. That's not sanitary. Right away, they have to report it to CPS or to any social services to try to get these kids safe. They will. And I probed and she sort of clarified, it's not that they try to find something wrong. It's that if they do, they are required to say it. In addition, individual and systemic biases also kind of shift this surveilling gaze towards poor families and families of color. Nowadays, folks are not usually explicitly saying, right, I reported this family because of XYZ, they have XYZ identity. It's typically a little bit more coded and maybe under the surface. So I shadowed, for instance, on one case where an elementary school administrator named Amaryllis alerted CPS after a mother named Graciela didn't respond to the school's calls to pick up her daughter with strep throat. So Amaryllis felt that this was neglectful as the child was miserable. She said, I think differently, I guess, as a parent. I would leave and come get my kid. I understand you're working. I work too. But of course, Amaryllis had the job flexibility and the job security to be able to drop everything to pick up a sick child. Graciela was in the middle of her fast food shift when the school called. And although she initially picked up, she couldn't be on her phone at work. And so she hung up and had to wait until her break to return the call. By that time, CPS had already been notified. So we see how professionals may use their own middle-class perspectives and experiences to extrapolate what other parents can and should reasonably do for kids. These kinds of biases are also baked into organizational culture and practices. So in Connecticut, I saw a number of cases where that involved toddlers that had gotten out of the house and were unattended on the street. So one of the CPS investigators there had seen New Haven police call CPS all the time over this kind of issue, even when it happened to two white ER doctors. Meanwhile, he said, I have a buddy, white as can be, living in North Haven, which is this adjacent suburb that's over 90% white. The same thing happened. That, meaning calling CPS, wasn't even discussed. It seems to be more of a cultural thing with the police department. And so even if individual people or organizations are treating families similarly, the stark segregation across our society means that practices across organizations, practices that are themselves shaped by systemic racism and classism, can produce inequality. And so finally, Darcey really covered this nicely as well. These surveillance experiences and fears fundamentally shape institutional and community engagement for mothers in poverty. So they talked about having to kind of take these various strategic precautions in interactions such as those with professionals in mandated reporting roles. So Colleen said, you definitely got to be careful with what you say to some people. And she clarified it's like any kind of agency, Head Start, the doctors, all of them. Some people, you say something to them, they'll take it out of context. They'll call CPS on you. You don't want to tell people you can't afford to buy your kids food or something like that, or clothes or anything, because they could take that too and say you can't provide for them. So because poverty and adversity prompt CPS reports, right? You can't afford to buy your kids food or clothes. There's this trade-off where opening up about your hardships could be a pathway to assistance in one view, but could also be a pathway to additional unwanted surveillance. And notably, this is happening proactively. Even before any CPS reports are made, mothers shared, right, that they didn't want to accept home visiting services, for instance, for fear of CPS involvement. Another mother, Desiree, was experiencing extreme material hardship and her welfare benefits had been cut off, and she kind of outlined her dilemma. She said, I feel like if, let's say, I tell welfare, hey, this mess is going on, I can barely afford to keep my kids. You can't afford to keep your kids? We're going to have to call the city on you. We're going to have to call CPS. I don't eat so that my kids can eat, but I'm scared to ask for any help these days because I'm scared it's going to work against me. So families are in this catch-22 where they have to weigh the risks and benefits of visibility to state and social service systems. And so what happens is that this can end up distancing children and families from the very systems that are tasked with supporting them. We look at Desiree's children and we think, this is not a situation we would want them to be in. And yet she's in a position where she worries that if she reaches out for help for them, the whole family will be separated and her children will undergo extreme trauma in foster care. So all of this, I think, is counterproductive when we think about, what we want or what we need in order to prevent child maltreatment and to promote child well-being. So I will stop there. Thank you all again for your time, and I'm looking forward to engaging in some questions and conversation with Darcey and with all of you.
Great. Thank you so much, both to Darcey and to Kelley. Wonderful presentations, and just a quick look at the chat shows how much people are appreciating your insights and your research. Before we jump into some of the questions that I have and that we put together, there was a clarifying question in the Q&A saying, can you define poverty-related neglect? And Darcey, would you want to take that one?
Yeah, so poverty-related neglect is any neglectful behavior or outcome or circumstance that's related to a parent not having the financial resources that they would need. So unsafe housing if they don't have, perhaps if they're homeless, perhaps if they don't have enough food to make sure the kiddos have food and appropriate clothing, anything that's related to their being in a lower socioeconomic status. That's what we call poverty-related neglect. I'm not talking about the difference is intentional neglect, and that's a parent who just says, I can feed you, but I'm going to choose not to feed you because I'm just going to choose not to feed you intentionally. So these are circumstances outside of the control of parents that are related to their financial status.
Great. Thank you for that, Darcey. Kelley, did you want to add anything?
No, I think that Darcey covered it well.
All right. Well, I want to start by emphasizing a point that's really key to so much of what you two have talked about here and what you've heard from moms in your extensive research, and that's that it's a small percentage of child welfare cases that actually involve children being removed from the home for abuse, either temporarily or permanently. But for the rest of those families in which the kids are still in the home while the investigation is open, there are still huge impacts on everyone in the family, and those impacts can continue even after the case is closed. Kelley, I wonder if you could expand on that a bit, and then Darcey will come to you.
Absolutely. So even for investigations that are closed, maybe the person that called it in thought, let me just have CPS go out, check it out. If it turns out to be nothing, no harm, no foul. At least we had someone check it out. But what I saw in my research is the way that these investigations really had these kind of ripple effects, where not only is the initial encounter terrifying and often traumatic, but families have to then sort of navigate a world in which now they understand, like quite concretely, the ways that folks around them, professionals maybe that they trusted, or as Darcey was saying, their own relatives or friends or neighbors are watching them and are ready to turn them into CPS. And so what I covered today in the presentation was primarily those like proactive strategizing responses. But there are also reactive responses where once families are reported, they then say, okay, now I know I can't trust, this hospital. Next time I wouldn't call the police if I were experiencing domestic violence. I'm going to cancel this social service that had been previously helping me. I don't want to open up anymore to my child's therapist. All of these sort of cascading ways that the investigation, which we would hope would help to sort of connect families or sort of bring them into the fold, connect them with supports, often end up distancing them from supports instead.
Yeah. I just wanted to say, so many of our parents, our moms that we've interviewed, Kelley, the narratives are just so similar. I mean, it's really incredible how when I read your moms, what they've said, it's so similar to what my moms have said. And basically the message is that getting help is fearful. Calling for help is a dangerous thing, because when you call for help and you report something and you go to like some behavioral health specialist, or you go to your medical doctor, you go to your psychologist, and you report these things are happening at my home, you are then at risk of being reported. And the systems overlap is really, really problematic, because once you're being surveilled and information's being collected from one system, it's ultimately going to get transferred over to another system. And so it's very intertwined. And that's a problem that we need to work on. And it's very stigmatizing. And parents have to navigate themselves throughout the world with caution at all times because they're afraid. And so it's a double-edged sword. My kid's sick, or my kid fell off the playground at the park. I don't want to take him to the doctor because I know that doctor's not going to believe me, or they're going to make a call. And the very first call is a traumatic call, no matter what happens.
One of the things that I remember from your book, Kelley, is the fact that one of the things that kind of adds points to an assessment of the risk is whether the parent themselves as a child had been involved in the child welfare system. Can you talk a little bit about how that plays in? And it seems like there's this is going to be an extra point, but there's also that parent went through that trauma much earlier in their own life.
Absolutely. So there are these real intergenerational experiences where CPS is not necessarily just something that you're encountering for the first time as a parent when they show up at your door. Certainly that's the case for some. But for, Black moms in particular, Black moms in impoverished communities in particular, Native American moms, this system, as Darcey so kind of compellingly articulated, has these intergenerational and historical resonances for families. And so, you might have the friendliest person at the door to greet you, but it just brings up all of this sort of family and community history of systems that have forcibly separated families, torn apart communities, and so on. So a number of the mothers that I spent time with who were involved with CPS as parents also had experiences in foster care as children. And those experiences really came to the forefront as they encountered CPS. So one of the mothers that's featured a lot in the book, Jasmine, when CPS came by for the first time, she describes this kind of rush of kind of like emotions that went through her when she heard that CPS was coming. Sort of all of her own memories of the trauma of foster care came to her, even though nobody thought that her son needed to be removed for the incident. She just sort of had the picture playing out in her mind of her son, her beloved son, going through what she herself had gone through in foster care. And so that absolutely shaped the entire interaction that she was then to have with CPS, because that trauma, that those memories were real, were visceral for her.
Darcey?
Yeah, it's definitely intergenerational, and it's intergenerational slavery, trauma from slavery, and it's collective and it's pervasive across our communities. And we all know what's going to happen when an authority comes and they know that you are going to be at risk of having your children being taken. I mean, think about it. The worst thing ever that can happen to a parent is have their children taken away from them. And so that's why I say there's a design flaw with CPS, because by design, the processes and mandated by the policies are coercive and punitive. We're going to punish you for being poor for reasons that are outside of your control. And you're then going to threaten you with separating your family, removing your children, and terminating your parental rights. So it's very visceral for folks, and they're very fearful, and it can be just like a gut-wrenching experience just to know that you're even being looked at. And I'm reading some of the things in the chat. Yeah, people are afraid to get help. And so I don't know what the solution is to destigmatize CPS and convince people that CPS could be helpful. I don't know what that looks like, because we have so many, decades and decades and decades of harmful outcomes from people who think that they're going to be getting help, but instead they're going to be harmed. And it's really very scary. I think that we need a lot more advocacy on the part of practitioners and everybody. We need to be in discussion and conversation, as I've been trying to do lately, with attorneys and judges who are making these decisions, ultimate decisions, so that they understand what this looks like. And like just at baseline, how on earth are we all accepting that we are in a position, we are holier than thou to judge people for a position in life that others hold, that we have placed them in? I mean, it's just rude to expect people to manage their lives from our own Western Eurocentric mindset and lens, those of us who are privileged and have the resources. We're not thinking about the original societal ill, which is poverty and racism, and how this impacts certain marginalized, minoritized communities way more than others. And they're in communities where there's going to be over surveillance.
Thank you for that. I think a natural reaction to hearing these stories, and we're certainly seeing it in the chat, is to ask what needs to change in these systems and how they contribute to the impact on these families. Darcey, can you talk about how the expectations and responsibilities of child welfare workers dictate their interactions with these families and how different systems overlap? And then Kelley, I'll ask you to share some examples of different approaches that may be healthier for everyone involved.
Yeah, so I'm asked a lot by practitioners and those that are working out in the on the ground with families and agencies. What are we supposed to do? How can we do it differently? How can we help in our specific clinical individual work with families? And I think approaching people with and from respect is the first thing we can do, having empathy. And I always try to encourage people, when you approach a family, to say, what happened to you? Just at the outset, acknowledge that something outside of that parent and that family's control has happened to them to land them in this position that they're in, where they're going to be, lots of oversight and surveillance. And aside from that, we need policy change. We need to do something about these mandated reporter laws, because the practitioners are earnest in their ability, their desire to want to help people. I believe that, but they have to follow the rules. Mandated reporters have to follow the rules. And so the rules are what the problem are. And so it's hard to give advice on how to change something when the guiding processes and policies are mandating that they continue the harm.
Kelley?
Yeah, this is such an important question, and I would love to hear wisdom from other folks on the webinar about things that they're working on, trying. I think the more people we have thinking about these issues and working in their various corners to move things forward, I think we'll have a much better sense of where we can really make a difference. I want to echo Darcey in terms of the advocacy work that individual practitioners can do, as well as their sort of interpersonal work with families. I think a lot of this is, as Darcey was talking about, seeing families in their full context and finding ways to support them. So rather than just saying, well, this family is homeless, that's a problem, we don't want the kids to be homeless, let me just call CPS. What are alternative routes to support that you can activate in your role as that trusted person for that family? I think that practitioners can also think about the information that they're gathering and why they're gathering that information, and providing context for families about why they might be asking certain kinds of personal questions. So in Rhode Island, for instance, one of the reframes, I talked about how parents were wary about home visiting, right? This just kind of evokes for many people like this strange middle-class white person coming into your home and maybe looking around, and maybe you're staying with other people or you don't want people in your personal space. And so when I was there, they were kind of framing this as family visiting instead of home visiting. And they were trying to put forward this idea of, we don't need to come to your home. We can meet at Dunkin' Donuts or wherever you like. We want to meet you where you are. Other home visiting programs are experimenting with virtual or hybrid services, and seeing how that might make this experience more comfortable for parents. And I think for services like that, there has been some pushback, this feeling like, well, we really need to be in the home. We see so much more in the home. And I think, we can interrogate that and ask ourselves, why is it that we have this impulse to be in people's personal spaces? I think that a lot of CPS agencies are also doing important work to educate the community about, sort of to clarify this mandate that Darcey has been talking about. So, for instance, I know there's efforts all over the country that are exciting to follow, but because IRP is in Dane County, I know Dane County in particular is doing a lot of work to build collaborative relationships, for instance, with local police departments to improve training and make sure they understand sort of which situations are do not rise to the level of a CPS report, right? So to hopefully try and curb this impulse that mandated reporters have or have been trained to act upon, to just report any and everything.
Yeah.
Yes, go ahead.
No, go ahead, Kelley.
Oh, and then just briefly, also at a system level, I think we should think about child protection work as so much broader than CPS. So every week it feels like there's a new research study coming out showing how economic supports are linked to lower rates of child maltreatment, rates of child welfare involvement. All of that I think is really encouraging in terms of shifting our approach from one focused on surveilling families to recognizing the strengths that families have and supporting them to raise their children as they would like to.
Yeah, the strength-based perspective is actually is critical, and that's what we need to be assessing. We need to not be looking for risk factors to plop them into whatever assessment tools we're going to and determine what's wrong with the family. But to your point, Kelley, we have to think, and some of the folks in the chat have been talking about rewiring. We have to rewire ourselves so that we understand, and we have to look for reasons not to make a report, so that touch doesn't happen. And that means finding the supports and resources that would help fix the actual problem, rather than placing these people at risk of surveillance. And just to tie it all together, I want to point out that there, to my knowledge, is no research, no evidence that mandated reporting actually stops maltreatment. Okay. Way back in the 70s, there was some work done indicating, okay, what is this? This might not be the right thing to do. And then it just went snowballed across the country in different states. Mandated reporting does not solve maltreatment. So all it does is places people under the purview and eye of authority figures in a coercive way.
I'm going to try to sneak two more questions in. We might run a minute or two over if that's okay. We did get quite a few questions about how dads fit into these situations and how their experiences compare to those of the moms who come to the attention of CPS. Kelley, I'm going to ask you to start on this one because you write quite a bit in your book about how gender plays into the expectations and assumptions of child welfare workers when they're dealing with moms versus other caregivers.
Yeah, so my research did not primarily focus on fathers and fatherhood. There's a number of wonderful scholars, including those affiliated with IRP, who are doing this work. So I'd encourage folks to check that out. I think absolutely the attention of CPS is sort of hyper-focused on mothers. And this is sort of a double-edged sword. On the one hand, it's the mothers who are primarily those that are the subjects of CPS's surveillance. On the other, fathers' contributions to the family may not be recognized as much. So once cases, for instance, are in foster care, there can often be, an oversight in terms of placement with fathers. Now, I will say that CPS agencies, at least those that I have been in contact with, are actively trying to shift that. So they're doing a lot of work around fatherhood engagement. And I think this is kind of a double-edged sword. On the one hand, it's great to see agencies recognizing the contributions that fathers are making. At the same time, engagement in CPS is also, opening fathers up to additional surveillance by CPS as well.
Thank you for that. Darcey, did you want to add anything?
Just so that she just pointed out that the systems overlap is just really salient here. So, and we have systems, processes, and policies, requirements for people to receive welfare and food stamps that began with, oh, you can't have so many resources, and men aren't allowed in your house. And if you have a man in your house, we're gonna question you more. So, and then we have the mass incarceration problem as well, particularly among Black and brown fathers. So there are systems that are separate but also connected that are separating dads from their homes. Dads absolutely matter too. As a Black mom myself, I am remiss in not collaborating with others that study Black dads because they are literally just kind of like separated out as if they're their own little thing that we need to be concerned about. And we're not doing a good enough job like figuring out how to support the entire family unit, right? And that's what we're not doing. We're thinking about the kids. We're not thinking about the family unit as a whole and how we want to encourage their well-being. Because CPS impacts the dynamics of the family altogether, including the dads that for one reason or another might be incentivized to stay out of the fray of further oversight.
Very briefly, but I would feel remiss in not touching on this before we let you both go. There have been a lot of questions in the chat from people who are working directly with families who are impacted by CPS and other systems. And Darcey, in your last slide, you thanked the moms who have trusted their stories to you. And Kelley, reading your book, it's very clear that you have put in so much time and work in building these relationships, building that trust. What would each of you say is the most key to build those relationships so that people who are working with these families and want to be able to offer supports that the parents and the kids, for that matter, feel that they can trust that they really are working in their best interest?
I would say think of the family and their needs and what they are expressing to you as their needs and put that first. So practitioners are under an enormous amount of constraints and pressure, right? They have enormous caseloads. They're trying to get everything done. And often how that manifests in some of these interactions that I observed is professionals are just trying to like get through a whole checklist and they're sort of corralling family stories, cutting them off, like trying to just get to the key points as quickly as they possibly can when the family is trying to explain to you, the circumstances of, say, their eviction that is actually prompting this domestic violence situation or whatever it is. And so I don't know that that's an individual practitioner solution. It's really a systemic structural solution in terms of allowing professionals to be able to have that time and space with families, really to be able to hear what they're coming from and respond to what they say that their needs are.
Yeah, I would agree with that. And I would encourage people to follow their North Star when interacting with families and consider the whole family, not separating out, we're here to take over your household and just protect your children and not pay attention to what's going on with you, mom, and further not pay attention to going on with you, dad, or the whole family as a unit. There needs to be compassion. And I would say just we need to, with all interactions that we have with families, take a step back and ask yourself, how am I harming, whether you're following a policy or not? How am I harming and how am I helping? And what can I do to mitigate the trauma that I'm going to inevitably inflict upon this family because of the policies that we have? And then I can't express enough, advocate, advocate, advocate. We need policy change. We need to speak to those people who are making the decisions, those people at CPS who are deciding whether or not to investigate, those people in the family court system who are deciding whether to terminate parental rights and separate families. So that's what I would say. We need to be extremely compassionate and thoughtful and empathetic towards others, because this is not fun for Black families and it's not fair. And we're actually not thinking about how unfair this is, that an entire system and group of helping practitioners and professionals are just going along knowing that people are being harmed when we're supposed to be helping people.
Well, that's a great place to leave it, and we are at time. So thank you so much to Darcey Merritt and Kelley Fong for sharing their time, experience, and research with us today. Clear from the chat that this was extremely well received and people were really hungry for this information. So thank you all for attending, and for the two of you for sharing your expertise with us. Thanks to Dawn Duran for handling the tech for the webinar, and to Natea Taylor for additional tech support. As we mentioned before, we'll be posting the slides and the recording of the webinar within a day or so, and as long as you registered, you'll receive a link to those by email. Thank you all for joining us today, and have a great rest of your day. Take care.